In partnership with Iraq Ministry of Health, supported by UNICEF, we proudly introduce the development of Civil Registration and Vital Statistics (CRVS) system, which will ensure accurate digital record keeping for every individual. The CRVS system is a comprehensive tool registering every birth, death, marriage, and divorce. It provides invaluable data and issues vital certificates that uphold individual rights and social structures. Let's try to understand why CRVS is essential. It's the backbone of dependable population data, paving the way for informed decisions. Every person gets a tangible identity, safeguarding their rights. And, in the bigger picture, it's our watchful eye on public health, steering us towards a sustainable future. If we look further into the importance of CRVS, we see that it's pivotal in ensuring our legal and civil rights. It acts as a catalyst for economic growth and validates our legal identities and citizenships. CRVS aids in accessing education and social services, plays a role in marriage and family planning, and is instrumental in research and policy making. Not to forget, it provides crucial demographic data and aids in meticulous public health planning and monitoring. Iraq's Ministry of Health relies on a paper-based system and is on the brink of a transformation. They aim to digitize the entire process using modern open-source technologies crafted by their IT team. This shift isn't just about going digital, it's about blending the existing with the new, ensuring that the advantages of technology align perfectly with the country's unique needs. This is how the paper-based CRVS system looks like. Let's look at the project. It is expanded over 16 months with 9 programmers. It is a close collaboration of UNICEF and the Ministry of Health IT team to ensure a more robust technical CRVS system. This will include Microsoft.NET Core programming training workshops to develop the first version of the system. Under this initiative, the Ministry of Health IT team will be equipped with Microsoft.NET Core Skills, a training program for health service digitization, and host intensive workshops to prioritize the digital transformation of birth registration and immunization tracking. The goal is to pave the way for a comprehensive e-health record in the future. The project has a total of 6 phases. The first phase is focused on empowering the Ministry of Health IT team through capacity building to administer Microsoft ASP.NET Core. Following that, in Phase 2, the team dived into a hands-on approach with dedicated technical visits to collect Ministry of Health specific business needs and requirements. Phase 3 is comprehensive system development, including planning, design, programming, coding, and testing. Once refined, the system will be deployed seamlessly onto Ministry of Health servers in Phase 4. For ease of use, Phase 5 will offer clear guidelines with thorough documentation, while Phase 6 is about iSeat's long-term dedication with unwavering technical support and maintenance of the system. The first phase expanded over a 15-day workshop on how to use Microsoft.NET Core programming language to develop web applications. The Ministry of Health IT team learned about Microsoft.NET Core. They got hands-on, helpful training materials, and even created their own projects. Here, you can see the teams and members involved in this workshop. In Phase 2, Ministry of Health needs were identified for the system through multiple discussions. The team visited places like the medical city in Baghdad to gather real-time data, and then crafted a design document, Software Requirements Specification (SRS), created mock-up screens, and emphasized an easy-to-use design. The SRS document is crucial, outlining how we'll transition from traditional paper methods to a digital approach. According to the SRS document, mock-up screens and wireframes looked like this when they were developed. The third phase featured 3 pivotal workshops focusing on the system's development. In the second workshop, the Ministry of Health IT team mastered the planning, design, and analysis of the CRVS system. They aligned on system expectations, initiated design frameworks, and set the development stage. In these pictures, you can see the teams involved in this workshop. Workshop 3 focused on training the Ministry of Health IT team on Microsoft ASP.NET Core to develop the CRVS system. The emphasis was on quality coding, collaboration, and ensuring alignment with Ministry of Health's expectations. These pictures show the teams and members involved in Workshop 3. In Workshop 4, the Ministry of Health team learned to use Power BI and made CRVS reports. The system's theme was updated after thorough testing and feedback collection from end users. After training, the system was deployed in both Baghdad and Kurdistan region. These pictures show the teams and members involved in Workshop 4. This is how the interface of the CRVS system looks like. Taking a quick look at the system functions, it includes birth certificate issuance and management, the same for Hujja and Qaid sections. Phase 4 was about system deployment. iSeed provided the technical assistance to launch CRVS on Ministry of Health servers in Baghdad and Kurdistan. The system will be active under the official Ministry of Health domain. Phase 5, iSeed trained the Ministry of Health team to handle, customize, and upkeep the system. Moreover, iSeed did detailed documentation with user guidelines. Additionally, Ministry of Health was handed technical documents to ensure easy future updates. In Phase 6, iSeed provided Ministry of Health with continuous technical support and maintenance throughout the project, including system debugging and improvements even after the system's launch. iSeed's commitment was extended to online support, ensuring the Ministry of Health team was supported until the project's end. This project was a success as all the milestones were achieved. Iraq's digital health vision was achieved. Ministry of Health IT was trained on Microsoft ASP.NET Core. The CRVS system was developed, launched, and set up in Baghdad and Kurdistan. Following project milestones, ICT's priority is sustainability. The Ministry of Health IT team is now equipped with hands-on training, and they have enough capacity and tools to manage the CRVS system's future updates. Essential documents, from user guidelines to design specifics, have been provided. And of course, the commitment doesn't end here. iSeed will continue to provide technical support for maintenance and broader rollouts. The system achieved is super powerful, as the CRVS system is 1. An open-source software that is free to use. 2. Ministry of Health owned. The source code is with Ministry of Health only. 3. Developed in the most recent and reliable technology. 4. Under dynamic updates without changing its code. 5. Hosted on a private server and standalone system. 6. Only the Ministry of Health team oversees managing system access and data sharing. 7. Flexible and dynamic system architecture enables user access and role management control. 8. Capable of real-time reports and dashboards. 9. Following best practices of data security and privacy. 10. Designed to share data and integrate with other governmental systems. 11. Designed to work online and offline on all devices. CRVS is more than just robust, but also interoperable. With a suite of open and well-documented APIs, it seamlessly connects with other platforms. Its efficient import-export capabilities ensure smooth data transfers, making integration a breeze. Let's look at the teams involved in this project. Team 1 is the Baghdad Ministry of Health team, with 6 members headed by Dr. Kinan, Director of the Health and Vital Statistics Department. Team 2 is the Kurdistan region team with 4 members headed by Mr. Harbi Asad Kato, Director of the IT Directorate in the Kurdistan region. Team 3 is the iSeed team with 6 members, headed by Mr. Amjad, Director of iSeed. This project is funded and supported by UNICEF Iraq Country Office. Thank you all who made it a success.